Well, hello there. Welcome. Welcome to Dr. Teach Me to Parent. Glad you're with me today because this is a very important topic that I'm going to address today. The world in which our kids live, the stresses that are placed upon our kids today as never before, issues that they've never dreamed of having to deal with, and that you as a parent have not dreamed that your kids have to deal with. So we're going to look at a whole host of stresses that are placed upon our kids today that are just overwhelming and creating this sense of anxiety and creating this sense of fear with which they live. Partly be responsible for the enormous increase in suicide among our junior high and high school kids today. Just taking the things that are going on in our society, in our streets, in our communities, and within our schools and within our homes, and saying, what's the effect on our kids? Well, it's tough. It's negative. It's not a happy picture. And it's not changing. It's going downhill, and it's going to continue to do so. So I want to unfold that a little bit today and just unpack this whole story of the stresses on our kids' life and the dealing that you have to do as a parent and how you're going to handle and cope with and help your kids deal with these issues in their life as you have to deal with them in your life. But before I do that, let me just kind of put in perspective with a piece of poetry or a little phrase that I think puts it into perspective what we're going to talk about today. And here's the quote: spend time, not money, on your children. You see, it's the time that these kids have that they want to spend with you. Sure, they want money, and sure they would spend their money, and sure they would savor their money, and sure that's a great thing. But when the money runs out, who's there? When the money goes short, who's there? And that's where you come in as a parent. It's far better to give your time, give your presence, give your involvement, give your personal contact and connection with your kids more than the money that you have to share with them and to allow them to utilize in their life. Don't be surprised over the need that kids have for you as a parent, not for your money. So, in perspective today, we're going to take a look at the issues of going on in our families, what's going on in our families, how our families are living, how our families are coping with the stresses of the day. A few years ago, I wrote a book entitled Achieving and Living a Healthy Lifestyle in a World of Stress. Well, today I want to talk about the world of stress that we are imposing upon our kids and that is being imposed upon us as a family. And how do you achieve and how do you live healthy within the context of a world of stress? How do you create a lifestyle that's healthy in a world of stress? I recommend the book to you. Get it in Barnes & Noble, get it in Amazon, call my office. Anywhere in the bookstore can get it for you. Achieving and Living a Lifestyle in a World of Stress, and I think you'll find something in there to help you. It's not necessarily a diet. I'm not advocating a diet. I'm advocating a lifestyle. Advocating a way of dealing with stresses in your life in an effective and a positive coping manner, rather than doing it in the form of buying something or eating something or digesting something or taking some kind of a regimen of pills or medicine or whatever it might be. No, live a lifestyle that handles stress and deals with stress. That's what this book is about, and I recommend it to you. Now, what I'd like to do is just kind of put this in perspective today about the world of stress that our kids live with. You know, Disneyland, we all know the song, It's a Small, Small World. Well, no longer is that a valid little song to sing. It's a big, buzzing, boozing world today in which our kids live. This is a huge world. It's an unfolding world. It's a scary world. It's a world that just impacts our kids in a way that is beyond their capabilities of coping. They're overwhelmed. It's an overwhelming world in which they live. So kind of listen to that today as we look at the way that our families have to kind of cope and deal with this, and you as a parent have to cope and deal with this. So here's the idea. We have a host of stresses that are going on in our world today. Now, we've all been told that COVID-19 is the source of a great deal of stress for our kids. We've been taught that. We've been encouraged to buy into that idea that somehow or another this COVID and staying home and staying out of school and distancing yourself and wearing a mask and being withdrawn from our world is really what's bugging kids today and causing them a great deal of stress. Now, to be sure, that's true. But don't believe the idea that that's what it is. I sat back and I went through the ideas and the world that's confronting our kids today, and I came up with a list of 40 issues and 40 events in 40 areas of life that kids have to deal with that create stress. These are stressors on the life of a child. COVID is one of those. And it may not be the most important, but there are 40 of them that I came up with that impact our kids. I'm going to give you a list of some of them. Can't do them all, but we're going to give you kind of a survey of the things that our kids have to deal with and the stresses that they have to live with, and what you as a parent, you have to cope with it as well and help them cope with it as you cope with it. So we have the kids' stresses, that's true, but we also have the parents' problem of responding to these stresses and helping kids cope with them, helping kids get through them, and helping kids understand them, helping kids know what to do about them so that these stresses are not overwhelming and are not overpowering the life of a child to the point that they become anxious, they become depressed, they become suicidal, they become withdrawn, they become isolated, they become unsocial, if you will. Kids today have a problem and have a stress and have a dilemma to deal with. And you as a parent, if you're not prepared, if you're not knowledgeable, if you're not able to act, you're not ready to act, then your kids are thrown into a world of confusion and a world that will overwhelm them and will be more powerful upon their life and their personality and their lifestyle and their value system and their behavioral patterns than you and as a parent and the influence you have upon your own kid. So what is the world today that our kids live in that overpasses and surpasses the devastating effects of COVID? Let me give you a list, okay? And just take these down as kind of a list of things that you as a parent need to be aware of, but that's facing our kids today. Some kids have some of these, some kids have all of them, some kids have other patterns of them. Some are true of younger kids, some are true of older kids. But it's the world of our child today. It's the world of our teenager. It's the world of our young child today in which they have to live. Critical race theory. Critical race theory. You know, that's just a modern day modification of the Marxist principle, the communist principle of critical class theory. The communist society, Marxists divided the world according to class, higher class, middle class, and lower class. And there were privileges and there were events that took place in these different classes. And if you were in a class, you wanted to be in the upper class because that's where the money was and that's where the privilege was. Well, critical race theory is the same thing, except they divide the world by color and not by class. It's a strange way of thinking. It's a strange way to impose upon a child to think that they are better than somebody else or less than somebody else because of the color of their skin over which they have no control. So, transitioning. What about transitioning? That's another one. These kids are being encouraged by school teachers and by principals and by school boards to transition. They're being encouraged by peers and they're being encouraged by parents to transition and to not accept the gender by which they're born, but to reject that and to seek a new gender, a different gender, the confusion that comes in that transitioning world of confusion for kids today. There's no place for transitioning a kid until he's 21 years of age. And at that, he has to make some choices. But the brain doesn't develop until he's 21 to 25. So we have no right to mess with a kid's gender when he's less than 21 or 25 years of age. We're doing an abuse of power upon the child and when we think in terms of genderism of children. What about just the use of pronouns? Can't use he or she anymore in certain schools and in certain social situations. That's abuse. You are a he. You are a she. That's what you are. And you have to accept a different identity and a different way of referring to yourself is a form of abuse. And our kids are being exposed to that kind of thinking. And that's creating confusion and creating doubt and creating that overwhelmed kind of a feeling. The illegal movement that's going on in our world today at the border, that's coming into our community and coming into our cities, of having cities referred to as being a safe city in some way, or schools being forced to bring in a population of kids from other countries and other nations of the world, and not being able to read, not being able to speak the English, not being able to understand what's going on in the classroom. Kids 15 years of old being placed in a third grade class with 7-year-old, 8-year-old kids. That's a recipe of disaster. And here we're putting our kids in that particular situation of having to incorporate kids that are totally different and have no basis of communion and no basis of fellowship and no basis of commonality between them, and creating a stress. And schools have not addressed this issue and how to handle that, particular issue. The drug availability in our society is huge. We know that these kids are into the marijuana world at age 11. That's the age that kids are into, 11 and 12. We know that the alcohol world is 11, the average age is 14. We know that. So these kids are being introduced to a substance, an emotional substance with which they cannot deal, with which their brain is not capable of dealing. But we're doing that as parents. We're allowing that as parents. We're encouraging that as parents. We're giving that as a model as we use drugs, as we use alcohol. As a parent, we're encouraging our kids to do likewise. The tattoo world, think of that as being a pressure and a stressor upon kids. Because the tattoo world says that you're not good enough. You don't look good enough. You don't present yourself good enough. There's something wrong with you. There's something inadequate with you. There's something marred. You're a marred person. And we need to somehow cover that up and direct it in a different format by putting some kind of a tattoo upon you and giving you this false hope that you're going to look better. You're going to be more attractive. You're going to have more friends. You're going to have more socialization. You're going to have less loneliness. But it doesn't happen. That just does not happen. It's a recipe of further rejection. The bully behavior that's taking place on campuses, school campuses, is enormous. Schools are not addressing it. Teachers are not addressing it. Kids are being subjected to bully behavior, and they carry the effects of that bully behavior on into their life. I see it all the time in my clinical practice when I talk to kids. And many of these kids have been bullied. And many of them remember that and have resentment about that as they go through life and mature. They resent the teachers for not doing anything. They resent the principal for not doing anything. They resent their parents for not doing anything, allowing them to be subjected to bully behavior. The abortion industry today is enormously pressing upon kids today. They're being taught about abortion early in life before they really understand the whole concept of birth and pregnancy, and then the abortion industry that has moved into that world and subjected our kids and encouraged our kids to behave in a manner that allows them the freedom to behave with each other, because there's always a solution. to the consequences of your behavior, and that's abortion. And kids get a sense of life is not precious, life is not valued, life is not honored. Life is short, and life is temporary, and life is at the whim of somebody else and a decision that somebody wants, to make. What about our school system itself? We have poor schools and we have good schools. We have public schools and we have a variety of alternative schools, of charter schools and private schools and homeschooling and various forms of schooling. Kids are confused about that. What school should they go to? Parents are confused about that. What should they do? There's that allegiance to your public school. You're supposed to be committed to your community's public school. That's how we all were raised. But the public school has let us down. The public school has let our kids down. We have increased the salary of our teachers every year. It goes up and up and up, and our teachers are being paid quite well, actually. But you know what? The academic progress of kids in those classrooms stays the same. And in fact, it might even go down. You can pay a teacher more and more and more, but you get nothing out of it for your student. That student doesn't get a better education, that student does not get better learning, and that student does not get better achievement. Unfortunately, they are disconnected. So the people that think that teachers just should get paid more, well, they got to think of the other side. Does it make any difference? No, it doesn't. The academic program of these teachers are no different than teachers who are paid considerably less. So it's not pay. It's something more than that. What about this whole idea about the free schooling, the free college, the free education that's being promoted today? The free preschool that's being promoted today by our president. Not good. Preschool is no place for a 3-year-old. 3-year-old belongs in the home and with his parents and with his mother and with the parents, with his family. Preschool is not an effective involvement of a 3-year-old. 4-year-old is different. 4-year-olds begin to have a brain and begin to have a interactional pattern that will help them develop their academic skills and their motor skills and their behavioral skills and social skills. But not 3-year-olds. That's early. That's putting kids at stress. That's putting kids in a demand environment. And they're not capable of handling that. Their brain is not capable of handling that. The whole idea of a free school, a free preschool, a free high school, a free elementary school, a free college. And we know, the evidence is there, the research has shown it, that when you pay nothing for something, you don't value it and you don't benefit from it and you don't have the achievement levels that you would when you pay for something and you value that much more and you work for it and you achieve. So giving something away is not necessarily getting a better result. It might make you look good, but the result is, not there. The national debt. What about that? Our kids are beginning to understand this whole idea of national debt. Every child in our country owes the American government today approximately $35,000. That's the debt that every child has tagged on his name. And if those that hold our debt come to our country and say, pay up, our government has to turn to every child, has to turn to every parent, has to turn to every adult and say, send me a check for $35,000. And it's going up, by the way. So that's what our kids owe our government today. And it's going to go up. And as they get older and they come into young adulthood, they're going to owe $35,000, $45,000, $55,000, $65,000 to the government. And that'll have to be collected through taxes. So that's a pressure on our kids. That's a stress on our kids. That's something that's before them that they have to consider. And you as a parent have to teach your child this whole area of national debt and what that means in terms of you paying it as a parent and your child paying it as a child. Can they do it? Will you want to do it? Will you be able to do it? That's the national debt stress that is placed upon us. What about the street riots that are going on these days? The Antifa street riots. We've been taught in our educational system, in our homes, to respect property. Not to tear it down, not to burn it down because you don't want something or you don't like something or you're mad about something. We don't teach our kids to be destructive around the house, to put holes in the wall and slam doors and burn up property because you're mad you didn't get your way. But that's what's going on in our streets today. A group of people who didn't get their way are mad. They're jealous. They're envious. And they're turning against the property owners, and they're against property and against stores and burning them down. And our kids have to deal with that. Why is that going on? Our kids need to understand that. And unfortunately, many of our kids are participating in that very same process. How about Black Lives Matter? A Marxist organization that is contrary to police. They're anti-cop, they're anti-police. They're anti-family. They're anti-religion. They're anti-church. They don't want that. What about that? Our kids have to deal with this Black Lives Matter movement and understand it and deal with it. And many endorse it, but they don't understand what it is. But it's an anti-movement. And when you have an anti-movement, you create a mindset that you're against more than you're for. And the list grows on and on and on and grows. So that's a very destructive movement and something that we as parents need to be very much aware of and not let our kids get involved in that kind of a negativism, that's taking place. What about the flag burning that's taking place around the country? And our kids see that on television, and kids see that in the streets. Kids see that in their schoolyards. That's an anti-movement again, a negativism, an anti-Americanism, an anti-government, an anti-country, an anti-democracy. So we're teaching kids to be negative and anti and against. And when you're against things, then you look for things to be against. And you develop a mindset of against. And then you look for things and you add your own list of things that you're against. And you become a negative, person. And negative people become more depressed. Negative people become more anxious. Negative people commit suicide. We're encouraged that whole process that takes place by all the stresses that take place within our, communities. What about the pornography industry? The average age of a child and being introduced to pornography is 14. New York education system. A city in New York is now introducing pornography literacy to grade 3 children. Today. Not in the future, today. A curriculum of exposing grade 3 kids to pornography. And where is that going to take them? Where is that going to lead them? We used to be concerned about child abuse. We used to be concerned about child molestation. Now we're teaching it. Now we're encouraging it. We're desensitizing kids to that kind of activity and that kind of behavior pattern. That's a stress on these kids. That's what the kids are living with today, and have to kind of deal with and use a parent. What about dress code issues? We used to have a dress code. Kids had to have certain hair length and had to have their skirts at a certain length and couldn't wear certain clothing and so on. Today, that's all gone. You take a kid as he is, and if you have to put controls on a kid or structures on a kid, it's an anti-American idea, and you'll be sued for that. So kids are being exposed to a wide variety of changes that have taken place, even in the way that they dress going to school in the morning. What about the woke culture? Woke culture is a culture that says there's no absolute. It's relativism. It's just relativism. What I think goes. What you think goes. And if we don't like each other, then we fight each other. Then we put down each other and we cancel out each other. That's how we deal. Rather than to try to come to terms or try to have tolerance or try to have balance or try to have acceptance and have flexibility and have respect for each other's points of view. That's gone. Woke culture says you do it my way. And if you don't, out you go. and the negativism that prevails around the woke culture. Our kids being exposed to that. Teachers are teaching it. Educational systems endorse it and favor it. Where is the absolutism? Where's the value system? Where's the North Star in life of these kids? We've taken away the North Star. There is no absolute. There's no point of beginning, a point of zero, if you will. It's all over the map. Our kids are exposed to that and are confused, by that. What's going on in the big cities of our world today? They're turned into jungles. They're turned into gang-infested pieces of property that are being taken over and being owned and being taken away from those that have paid for it and worked hard to have property of that nature. The burning and the destruction that's taking place in our big cities today. You want to live in a big city? You want to live in a big city today? Probably not. But yeah, many of our kids do. And that's what they're exposed to. The homelessness that takes place. Much in our big cities today, the homelessness our kids have to deal with and have to live with and have to watch and see and walk by and be part of. It's part of their community. The confusion that must be in the mind of a child to think that there are people that live homeless and they live on the streets. It's not necessarily the homelessness, it's the street child. It's a street person. Many of them could have a home, could have and did have a home and have a place to live, or it's offered to them, but they choose not. So they're not homeless. They're street preferred people. And that's how they want to live. And our kids then have that as an example. Kids have that as a value. Kids have that as a way of life. It's enticing to some kids. It's rejecting by other kids. The sanctuary cities, that whole idea that you can protect the criminal. You can protect the one that creates crime. Did you see in the news recently this kid that committed a crime in open public and had 17 prior convictions against him for crime behavior and court action? And he's still valid on the street and walks the street and still committing crime. And that was crime number 18 they committed. What are we doing? What are we exposing our kids to? What are we saying is good and right and proper, with our kids and for our kids today? We're allowing that to take place. And then we have the school issues of online classes and in-school classes and all the various ways that education can take place. Some of that's good. Some of that has value. But it's a confusing issue for kids to choose. When you go to a fourth grade kid or an eighth grade kid, and you say, well, how do you want to have your education? You want to go to school? You want to stay home? You want to go to school in your pajamas? You want to go to school dressed up? That's what we're providing choice for our kids, and they're confused. And, of course, they're going to take the least of the evils. They're going to take the least resistance. And that's how they're going to have their education. And our educational advancement as a country is beginning to plummet, going down. And we're going to go down. We're going to plummet. We've gone through a year of non-education, minimal education, minor education. And we as parents, need to be thinking that through as to how we're going to deal with that in the future. Is that what we want as our standard? Is that what we want our kids to do throughout the rest of their educational experience? Or do we want to rise to the occasion and give kids quality education? And in many cities, in many areas of the states around us, the quality education is not in the public education, it's in the private education, it's in the alternative education system that's available. And parents, you need to study that, you need to understand that, and explore that for your kids and what is best, for your kids. So you see, that's just a small list. There are other items you can add to that list. These are the things that our kids are exposed to. These are the kids that are the things that our kids have to think about. These are the things that our kids study in school. These are the things that they talk about among their peers. These are the things that teachers advance and advocate for in the school system. That's what you're sending your kid to be exposed to, this kind of thing in the educational system. If you agree with it, no problem, obviously. If you don't agree with it, you're putting your kids into a great deal of risk and stress. Because if he goes to school and learns a value system that is different than what you teach at home, you are presenting a kid with a great deal of conflict. And conflict is not good. Conflict leads to anxiety. Conflict leads to depression. Conflict leads to withdrawal and isolation. And conflict leads eventually to very disastrous activity, suicide being one of them. So we have to kind of really think that thing through as parents. So what I say then to a parent is this: you have 3 things to think about, 3 things to do in light of the stresses that are imposed upon your kids on a daily basis. You need to be aware of yourself. You need to study these issues. You need to talk about these issues. You need to read about these issues. You need to be knowledgeable. You need to be educated about these issues. You need to be able to talk about these issues. You need to be able to understand them. You need to learn these issues that your kids are facing in their daily life at school and in the playground and out in the community and wherever they go, and even within the churches today. So you need to be aware. You have a lot of understanding to acquire. You need to take some time off from all your activities and start studying these things and listening to your kids and talking to your kids and learning. Let your kids teach you. That's number 1. Number 2 is you need to take some action as a parent. You need to take some action. Here's what I mean by that. You need to speak up. You need to write letters. Write letters to your school board. Write letters to your school superintendent. Write letters to your school teacher. Go talk to your school teacher of your kids. Write letters to the editor of the newspaper. Speak up. Get your voice heard. All these other voices out there are speaking, and they're speaking to your kids. You speak. You speak to the community. You speak to your kids. You speak to the leaders of your community. Be a voice. Be heard. You have something to say. You have an opinion, but be proactive with that. Make sure that you put your foot down, but you say it and you communicate it within your community. Go to bat for your kids. Advocate for your kids. Be their advocate. You can no longer be a passive parent. That's number 2. And here's number 3. Teach your kids to be respectful. You be respectful. All these points of view out there, you either agree with them or you disagree with them, but you can be respectful to the people who hold those points of view. We live in America. We live in a country where we allow various points of view to prevail. We allow points of view to be advocated. Your point of view can be advocated also. But we want to learn and we want to teach our kids to be respectful of all people, whether you agree with them or you don't, whether you advance their point of view or you don't, whether they like you or not, whether they're respectful towards you or not, whether they understand your point of view and your thinking or not. Teach your kids to be respectful of others, to be accepting. You know, there's a golden rule out there. Don't forget your golden rule. Don't let your kids go through life without knowing it. You do unto others as you want done unto yourself, as you would want to be treated yourself. Let that golden rule prevail. Let that be part of our community motto. Let that be part of your family life motto. Build in that issue of respect for each other. Allow people to have their point of view and encourage them to allow you to have your point of view. That's where our community will come together. That's when we take hostility and we melt it together and we bring about peace and we bring about unity and we bring about some cordiality at the community level, within your family, within your community, within your neighborhood, within our country. We need to approach life from the point of view of respect, not from disdain and not from competitiveness, but from cooperation and coming together. That's your job as a parent. That's what you need to do as a parent. I have this image. I got this image. Disneyland. Let me come back to Disneyland. You all been on the little boat that goes through the tunnel of the small, small world? And you've been in that little boat that goes through the tunnel, the Pirates of the Caribbean? What do you experience when you go through those little tunnels and you sit in this boat and all this music comes at you and you're enthralled by the music? Then you turn around the bend and all of a sudden something grabs out at you and speaks at you or barks at you or scares you or attempts to scare you. And then you go a little bit further and all of a sudden another one kind of jumps out at you and tries to scare you. That's what's going on in our community today. That's what's going on in our world today. We are in a boat of the small, small world that has become a big, big world. And there's things that come at us that are scary. It's the Pirates of the Caribbean. We go through this life, pattern, our ages, and all of a sudden something comes out at it to scare us and to create a disdain in our life. That's what's going on. That's what's happening to our kids. That's the life that they live. Think about it. And parents, you need to prepare them for that. Parents, you need to help them understand it and how to deal with it, how to deal with the surprises that come into their life and come into their world of debate and discussion and education. It's not a safe world anymore. So you parent, you need to hold their hand a little bit longer. You need to be with them a little bit longer. You need to go with them a little bit more. You need to talk with them a little bit more. We need table talk time. We need car talk time. We need bedtime talk. You need a time when your kids can tell you what they're hearing and what they're thinking about and what they're being taught in school and what their questions are and what's being brought up in a scary way. 2 days ago, I sat with a parent who has an 8-year-old kid. And that kid came home with brochures from the school of what they had been taught that particular day. Totally contrary to the home value system of that parent. That parent and that child spent 1 hour discussing what the child had been taught in school all day, and it was on critical race theory. And the parent had tried to help that child understand the alternative to critical race theory and the horrors of critical race theory. And he put into perspective why that is being taught. And the teacher did not help at all. The parent had to do the job. The parent had to do it at home. The parent had to do it during their time. And the parent, that's an example. That's a model. You need to be that kind of a parent. What are your kids hearing and thinking and receiving and reading at school? And then you need to be able to discuss. You got to have time for that. You got to have wisdom for that. You got to have knowledge to do that. You have to have understanding to do that. No longer can you be ignorant about what's going on in your school today and what's going on in the life of your child and what's going on in the life of your child as they move out into the community and into the world in which they live. Keep your eye on your kid. It's a stress world, and you need to be the anti-stress parent to these kids in that world. You see what I said? It's not COVID. It's not COVID-19. That's part of it. It's one aspect of it. But look at all the things that your kids are being exposed to. That's the issue. Well, nice to talk to you on that one today. I'm going to come back. We're going to take a break. And here's what I want to discuss when I come back. Should a family member be part of the health care of another family member? Should a family member go to the doctor's appointment? Should the family member be part of a doctor's appointment? Go into the office, be part of the doctor's procedures and what the doctor tells the patient and advises the patient and prescribes for a patient. Should family members be part of that process? Interesting research that's being done on that. We'll talk about it when we get back. See you in a couple minutes.
The Green Gables Care Home is a 24-hour assisted living facility for the elderly located in Clovis, California, offering spacious private and semi-private rooms which are wheelchair approved, catering to the special person in your life who needs attention and wants to live in a loving home environment. The Green Gables Care Home has assisted living in secured homes for elderly with Alzheimer's, memory loss, and for your loved ones needing assistance with their activities of daily living. Call 559-297-9438 and visit greengablescarehome.com.
Sometimes good intentions hurt rather than help. For just $1.76 per meal, the Fresno Rescue Mission offers more than food. We offer hope. Please donate today.
Do you need a locksmith? Layman's Lock and Safe Service and Repair is available for you. 559-228-1805.
Gained a lot, learned a lot, and got a lot of love. If it weren't for the knowledge that I had gained from the classes at PCC, I probably wouldn't be the mom I am today. See, there it goes.
I would love you to meet my son, Aaron. My situation was very difficult. I didn't know how my life was going to turn out.
We graduated in June 2010 and we got married in July. And through family, the Pregnancy Care Center changed our lives.
The Pregnancy Care Center was a huge, vital part in helping me walk through that pregnancy, in educating me and loving on me during that time.
Choosing a Medicare plan can be difficult and frustrating. Susan Hatch can guide you through the Medicare maze and help find the right plan for you. Susan helps people understand the confusing and drastic changes that occur every year in Medicare. When you need a dentist who has a passion for superior aesthetics and comfort, you need Dr. Christopher Wong with Cedar North Dental. Call 559-432-4948 or visit cedarnorthdental.com.
Hey!
Try to close the club.
Tanya, come here.
At Boys and Girls Clubs, it's not just about trying new things.
Kitchen, my hometown.
It's not about learning the right steps.
4,
or making contact.
5, 6, 7, 8.
It's not about exploring the future. It's about helping them build it. It's about taking steps to greatness. About making a connection. It's about proving every kid and teen has what it takes. It's about people in our clubs who bring out the greatness in every kid who enters our doors. It's not just about being on stage. It's about walking across it. Great futures start here, and here, and here.
Welcome back, and I'm glad you're still with us as we now move to a little different topic, and but it has to do with family life. I recently became became aware of an article published in the Minnesota Physician, and it's a current issue, and it raises the question about the involvement of family members in the medical care of another family member. Should they be involved? And how do doctors handle this? Well, here's the research a little bit that prompts this particular question. 40% of the patients who show up in a doctor's office have some form or some aspect or some level of a mental or emotional or behavioral problem. 40%. And doctors are not trained to deal with that. Doctors are not educated to deal with that. Doctors are not experienced to deal with that element. Maybe that's the role of a parent, is to help a doctor deal with the underlying issues besides just the straight objective medical problem of a particular patient. 70% of patients presenting themselves in a doctor's office have some kind of a contextual stress to the issue that they are going to the doctor for, whatever the medical issue is. It may be a stress in their work world. It may be a stress in their home life. It may be a stress in their marriage. It may be a stress in their relationships at work, wherever it might be. 70% of patients going into a doctor's office for some medical issue have a contextual stress that promotes or supports or exacerbates or makes worse that particular medical issue being addressed. You see, family members are present. Family members are involved in the issues of each other, including their medical issues of each other. Family members are either a source of support or they're a source of stress upon another individual and contributes to the medical problem of that individual. They're part of the solution or they're part of a problem, if you will. Depends on how you handle that. You see, family members can be ignored, or they can be included, or they can be excluded. And the research is beginning to show very clearly that we want family members to be included. It's good to have family members included in the care of a patient that's their family member. Make them be the source of support, not the source of a problem. Let them be the source of a solution, not the source of the stress. That's the role of the doctor. Unfortunately, though, doctors shy away from this. Doctors don't like family members being present in the consulting room. They don't like that. Many doctors don't have communication skills that facilitate that. Many doctors don't have social skills that facilitate that. Many doctors don't know how to talk to parents. Many doctors don't know how to engage in conversation with parents on alternative questions and points of view and so on. They've been taught to just think it through, write the prescription, and move on. So the world of the medical profession, the world of the physician, is generally not one to include and to incorporate and to welcome into the medical community, into the medical system of care, family members. However, the research is really quite different than that. Considerable amount of research has shown this, that when you take an area of medicine and you say, okay, now what happens to patients who have family members who participate in their care? What happens there? Well, internal medicine shows a great deal of benefit. Pain levels go down, healing speed increases, medication use decreases. There's a benefit to the patient when family members participate. OBGYN doctors report the same thing. A much better result when there's a family member that participates in the care. Oncology, the healing rate is much better. The coping rate is much better when parents or family members participate in the care of a family member. Psychiatry, psychology, mental health, addiction, all show better results when family members participate and are part of the solution and part of the care system that's take place. See, everybody wins. But here's the interesting study that was done. When doctors allow family members to come into their consulting room and incorporate them in the care system and incorporate them in the medical system of care, doctors are happier, their staff members are happier, the number of appointments go down, they're fewer, and there is a general feeling of happiness, a general feeling of goodness in the office that prevails when the offices allow family members to participate. I allow family members to participate. I encourage family members to participate. I welcome family members to participate. I want family members to participate. They are a source of solution. They are a source of the healing process. They are a source of encouragement. They just need to be educated. Family members just need to be educated. Family members just need to be told how they can play a role and what role they can play and how they can benefit their family member. So you need to take time, but you need to incorporate them as a resource in the solution, to the problem. Yesterday I got in the mail a letter from a husband that I encouraged to participate in the therapy program, in the evaluation program of his wife. I could have seen his wife in my office by myself and done my evaluation of her and created my report and prescribed a program. I could have done that. But no, he is a vital person in her life. He needs to be part of this. He's going to be part of her solution. I educated him as things he could do, how he could help. So you make use of the family members. You don't reject family members as a physician, as a doctor. Make sure that family members are welcome into the consulting room, into the treatment room, into the treatment program, into the treatment process. Let family members, kids, parents, relatives, friends, whoever your patient wants to include, allow that to take place, and then use them as resources as part of the healing process. That's what a doctor needs to do. That's what a doctor needs to learn. Unfortunately, they're not taught that in medical school. They're taught to reject family members in medical school. But family practice has some value. That's when you bring family into the practice, into the solution. And you can learn from family members, and you can help family members benefit the patient. It works both ways. But you need to be open to that. You need to be comfortable with that as a doctor. So the question is, should family members be allowed to participate in the medical evaluation and care of a family member? The answer is strongly yes. And you got to find out how that can take place. As a family member, talk to your doctor. Invite yourself in. Work that out with the family member who is going to be the patient. And then be respectful of the doctor's time, be respectful of the doctor's experience, be respectful of the doctor's knowledge, be respectful of the doctor's recommendations, but play a role in the healing process and find out the role that you can play. That's why you're there. Well, let me end today with a little quote. It's a little funny one, but it kind of tells you what we just talked about. Here's the quote. Never argue with your doctor. He has the inside information. So, kind of take that as a point. The doctor may have an advantage having certain information that you don't have. Kind of respect him for that, okay? And be part of the process. Be part of the answer. Be part of the solution. Don't be part of the stress. Don't be part of the problem. Be part of the solution. You can play a role as a family member, but invite yourself in. Work that out at home first, and then go together and make your care system in your home a family system of care. Nice to talk to you. Glad you joined me today. These are tough topics, stressing the life of a kid and how parents have to deal with that, and it's increasingly difficult. But parents, you're up to the job. You're up to the task. Take it on and do it. But also, parents, go to the doctor. Dad, if you're not living with your child, you're divorced, or you're separated in some way, make arrangements to go to the doctor with your kid. Be part of the solution. Be part of the answer to his medical problem. Don't let separation or living separately or a divorce keep you from the medical care of your child. Be part of that, all right? Bye for now.
Uh-huh.